everybody. Happy Wednesday.
Happy Wednesday to you.
Hope you all are doing well. Please join us as we discuss
Esophageal dysphagia.
Perfect. And we're going to make meatballs, chicken meatballs, because I have this cookbook that I checked out from the library because I am a part of a cookbook club with another dietitian. And her idea was everybody cook something from the cookbook, bring it, and we'll just have a little potluck.
Do you guys all cook from the same cookbook?
Well,
from any cookbook?
I thought yes. So we pick a cookbook.
I see. Okay.
This time they just picked, a lot of the ladies picked recipes from this lady.
Okay.
So she's got a lot of great stuff. One of the things in here is coq au vin Blanc meatballs. So that's what we're going to make today because they're going to be a really, really nice minced and moist. And because they're soft, ground chicken is soft and easier to eat than ground beef. It has less stuff in it.
Yep.
And it should puree easier. And it's got a bunch of sauce with it. And it's very nutritious. So, yes, it does have wine in it because coq au vin is French for chicken cooked in wine.
But the alcohol cooks out.
It'll cook out, yes. And typically they would use red wine for coq au vin. So it's coq au vin Blanc because we're going to use white wine. So I'm going to get started making meatballs. So we have a pound of ground chicken, some eggs, some breadcrumbs, and some salt and pepper. And I'm going to mix all that together and make some meatballs while you get us started.
About the esophagus.
The esophagus.
Let's talk about the esophagus. What is the esophagus?
I hear it's a tube.
It is a tube.
That connects your mouth to your stomach.
Yes. And I hear that you know exactly how long the esophagus typically is.
I looked it up today. Yes, it's 25 centimeters. And if I had done the math, I would have been able to tell you how many inches that is, but I didn't do the math.
That's okay. I don't know. I don't have the math.
So if you take 25 and divide it by 2.54. Hi, Kara. Thanks for joining us.
Hi, Kara.
That will give you inches.
Okay.
So 2.54 inches. I can't do it in my head either. So if
not a math major.
If someone wants to do it for us, that would be great. But the esophagus is about 25 centimeters long.
So whoever's watching, tell us how many inches the esophagus is.
Yep.
So the esophagus is a muscular tube that connects the mouth to the stomach.
Yes.
Now, it's not directly from the mouth to the stomach. There is the pharyngeal, the pharynx, in between the esophagus and the mouth.
Right.
And the oral cavity. So
and that's where the swallowing happens.
That's where the magic happens.
The magic. I like that.
It is the magic.
Let's refer to it as the magic from now on. I like that.
Got it.
All
right. So let's talk about esophageal, which is where esophagus comes from. Esophageal dysphagia. Esophageal dysphagia essentially is basically difficulty swallowing, but that relates to something going wrong in the esophagus.
Right. Okay.
So swallowing occurs up here. So it's kind of confusing because if you have difficulty swallowing, the esophagus starts
right.
Farther down.
When you say something goes wrong, this could be something gets stuck.
Well, we're going to go over that. There's a lot of different things that could be the cause.
Janet, 10 inches. Thank you.
Janet, I knew there was a math person out there.
Love it. Thank you, Janet.
So just under a foot, 2 inches under a foot.
Yeah, it's long. Your digestive tract, so your esophagus is part of your digestive tract, just like your mouth is.
Yep.
So it's important that we take care of it.
Yep.
Okay.
Very good. All right. So esophageal dysphagia, difficulty swallowing related to something going on in the esophagus. Mm-hmm. So what are some of the causes? You also told me that you looked up
the number one cause of esophageal dysmotility. So the esophagus stopping working. The number one cause is acid reflux.
Acid reflux.
Which we have talked about before and we will talk about again because it's it's one of those topics that you just can't talk about enough.
Well,
really.
that is actually probably a whole show.
It is.
It by itself.
Yeah.
That we could talk. And I think we did.
Yeah, we did.
We did.
And we will do it again.
We do everything again. So
have to. We get new people that need questions answered.
Scroll through and you can watch them all and just rewatch the same episodes.
You learn something new every time, even though it's the same information. So it may hit differently the next time.
Right. Well, we may say it in a different way that hits someone differently.
Right.
That is really soft. Really soft.
It's very sticky. So so we do have the screen so I can see what I'm doing here. So I'm going to make, I'm going to roll these out. So in the pan back here, I cooked some bacon. You may be able to see it on the cutting board back here. We just did like 2-ish slices of bacon. I'm going to chop those up in a little bit, but the pan has bacon fat in it. Is this dietitian approved?
Yes.
For today, yes. Because it's going to be super, super flavorful and it's going to have a really nice mouthfeel. And the bacon fat is going to help it puree better.
Yes.
Because chicken is very lean. So this is 90-10, which means it's 90% lean and 10% fat. Which we like because that typically means it has less texture, gristle.
Yep.
Some of that fat is solid in ground beef. It's a little softer in chicken, but the extra fat is going to help this puree nicely. So I'm going to turn this on, and I'm going to make meatballs and add them to the pan, kind of as we go.
Okay, it's
very,
on. I have
very
it at
soft.
medium.
Beautiful, thank you.
Okay, so causes, GERD, number one
Acid
reason.
reflux. Yep.
And we can talk about the reasons for that, but there are other things that would cause esophageal dysphagia. One of them would be a neurological disorder. So the messages from the brain to the esophagus, if there is something going wrong with that messaging system, that could cause.
Yep. And so one of the other things that I think I talked about last time we did this was that the vagus nerve is the number one nerve that connects the brain to the stomach. It innervates or connects to the esophagus in many places. So you need your vagus nerve to work because it sends a lot of information back and forth.
Yep. Good. All right. So another one would be a muscular disorder. Difficulties or muscles.
So muscular dystrophy is the first thing that comes to mind for me with that. Yeah.
There is, so the esophagus is not made of all striated muscle, some smooth, some striated. So differing things going on there. So depending on what's going on with you and what kind of muscle is affected.
And I want to clarify for those of you that don't know what this means. Smooth muscle is muscle that is involuntary. You cannot cause it to contract like your heart. Your heart is made of smooth muscle. It contracts on its own based on what your brain tells it to do. Striated muscle is like these muscles that I can tell it to do this.
Right.
Yeah.
However, the striated muscles of the esophagus, you don't have voluntary control of.
Right.
You can't.
Just at the pharyngeal level.
It's related to all, at the pharyngeal level you do.
Right.
But in the esophagus, the striated muscle is more innervated by other muscles or other innervations, other movements that are going on. So another one would be structural. Structural things. So there's a number of those. There could be a stricture, which means that there could be a part of your esophagus that is smaller. It's constricted. So that's a very common one.
Yeah, it's very common. We hear about people having to get these dilated or made wider all the time.
Right, and that's just something that hereditary, you see it frequently as a hereditary.
And I was going to say, and we get into how do you diagnose this, but I know you're going to get to that, so I'm going to keep on.
We will get to that.
Rolling my meatballs.
Roll. Okay, so another one would be an esophageal ring, and that would just be a band of I can't think of the word. What is the word? No, it's not muscle. It's like ligament.
Oh, okay.
A band of ligament that is not being cooperative with the rest of your esophagus.
Right. Right.
So esophageal ring.
So,
another one would be a hiatal hernia.
Oh, yes. I know a lot of people that have these, and actually I had a patient at the hospital who had one. She was like 80, and I didn't know she was a patient. She looked spry, let me tell you. And she was doing just fine, and she was able to come back from it, but they did the surgery called the Nissen fundoplication.
Yep.
To correct it.
So what a hiatal hernia is where part of your esophagus gets caught in the muscle in the
diaphragm.
Yes, thank you.
Yep.
In the diaphragm. So there's a hole in your diaphragm that your esophagus empties through.
Yep.
And if part of your esophagus gets caught or pulls through,
or if there's a weird hole in your diaphragm,
or if there's a weird hole in your diaphragm,
which can happen. It's common.
There's actually so many things that are more common than
that.
Yeah, no, not than that, but that people in general don't realize.
Yeah, so true.
Yeah.
So true.
So achalasia is where the sphincter, usually it's mostly in the lower esophageal sphincter where it won't relax. So it so it won't open, so it doesn't allow food or liquid to go through into the stomach.
So when people talk about their esophagus is narrowed, is that similar?
No.
Okay, so that's something different.
Right. So achalasia is more about the sphincter just at the bottom. So narrowed would be you can have inflammation that narrows your esophagus.
Yep.
That could be caused by can help improve the hiatal hernias. Super common knowledge. So if someone wants to talk to a chiropractor about it, it's pretty neat. Cool. Okay, cool. Alyssa, thanks for that information.
I hadn't heard that. I'm watching. I'll be there in a second.
That's all right. So there's a lot of things that can cause the esophagus to narrow, but this is more, achalasia is more about it constricting and not relaxing very easily.
Okay.
So then food goes down the esophagus and essentially backs up.
Yeah.
So that's part of it.
Yep.
Another one would be a diverticulum. So we hear about diverticulums a lot, or diverticulosis. So what is diverticulosis? Diverticulosis is where you get a little pocket, a pocket in the esophagus. If it's higher, it's called a Zinker's diverticulum, if it's in the pharynx.
So typically when we talk about diverticulosis, it's in the bowel, in the large bowel.
Well, they have diverticulums in the esophagus as well. So most people, not everybody knows that, but it is possible. The most common one that we see that affects swallowing is up high and in the pharyngeal area, and that's called a Zinker's diverticulum. But it's a little pocket, and as that pocket fills up, it closes off the esophagus.
Yeah. Yeah.
Because it just takes the space.
Right. There's nowhere for it to go.
Nowhere else for it to go.
Back up.
Yep.
Okay.
So that's the structural thing. So another one could be tumors or cancer. Not suggesting that you should go to that
extreme
self-diagnosis quickly, because that is more of the rare. And another one is esophageal eosinophilic esophagitis, which is an inflammatory condition. Right. Eosinophils are a type of white blood cell.
Yep.
That rush to an area. You typically don't see a lot of them. If you have blood work done, you typically don't have a lot of eosinophils. If you do, there's something going on. There's something not right. And usually it's your body freaking out and going, there's something wrong, we gotta fix it. Yeah.
And that causes inflammation because inflammation is how your body heals.
Yep.
So inflammation is a good thing, acutely. Chronic inflammation, which means it lasts a long time, is a bad thing. That's when we have to worry.
Yeah, it's accurate.
Kara, that's what happened to you. Yep. So sorry, hon. Yeah. Yeah. And that's why we're here for you.
Absolutely.
Giving you the information that we can. And we love answering your questions. So keep asking.
So ask questions. Tell us about your journey, and maybe we can help you through that. So some of the symptoms. So let's talk about symptoms.
Yeah. So my first one, I would say, is related to reflux. Is what I typically see, where there's heartburn.
Okay.
Well,
Yeah. Pain is the number one.
Pain.
That's my number one. Pain or
Okay.
discomfort.
Okay. Yeah.
So pain or discomfort during the swallow, so while you're swallowing, or during mealtime, or even after mealtime, especially if you have something acidic. I hear a lot of people tell me that they have reflux after eating pizza or spaghetti or something that's high acid.
Yeah. Trigger foods is what we want to avoid.
Mm-hmm.
Doesn't matter how many times I hear, I always feel better after these discussions. Yes, because that's what that is. Yes. And this is why we continue to say the same things over and over and over again. Because a lot of you need the validation. Mm-hmm. And that's what we're here for, because other healthcare practitioners are not giving that to you.
No.
And it's kind of comforting to know that someone else knows what you're going through. So the people watching, typically, they feel you on a level that other people don't.
Yep.
So we want to create a safe space for you guys.
Right. And we're giving credit to what you're feeling and it's what is real for you.
Yep.
We believe you. We know that it's a problem, and we want to help you find a solution to your problem. Yep. We are solutions based. We are not.
Correct. So I'm just showing you what's going on here. So I'm turning these meatballs. We've got a little bit of a crust. I don't want to get too much because I want them to still puree easily. Mm-hmm. But we're just gonna make sure that they cook all the way through, because
smells. I wish they could smell this.
And it's simple. It's bacon grease, which is one of my favorite things. I'm not gonna lie. Did you know 100 years ago we didn't have plant-based oils, and we just used animal fat for things?
Yes, I believe that. I didn't.
True.
I had never thought about that.
But it makes sense. Yeah, I had a buddy tell me that this week, and I was like, yeah, because that's what we had. We didn't have plants and factories to process soybeans down into oil.
Right.
It wasn't a thing. Yeah. Anyway, so there's a whole group of people out there that thinks animal-based fats are healthier than plant oils because they're less processed. Beef tallow. That's exactly where I was going with that. But yes, thank you, Alyssa.
Good job, Alyssa. Thank you, Alyssa. All right, symptoms: pain and discomfort. That's, when you have heartburn, that's painful. Mm-hmm. There may also be, if you have EOE or if you have any other kind of inflammatory issue going on with your esophagus, it could be painful. It could just burn. Yep. So if you think about when you have a sore, or you have an open area, if something goes across it that's acidic, or it could be anything. Salt.
Think of a cut on your hand and using hand sanitizer.
Right.
Yeah.
So if you have an esophagus that's inflamed or just irritated, then it could hurt. It could be painful.
Yep.
So another thing could be that you feel like food gets stuck, whether it's stuck up high or stuck down low. It could be anywhere in your esophagus. There's referred pain, referred feelings. So when you tell me that you have something stuck right here, I don't believe that it's actually exactly right here, because typically we feel it a little bit lower than where it is. So if you tell me it's here, then I'm guessing it's a little bit higher.
That's really interesting. I didn't know that until you and I started doing this together.
Yeah.
I didn't know that referred. I mean, it makes sense, but that was news to me, and I'm still fascinated. So every time someone says it's stuck right here, I look at Stephanie. I'm like, okay, where's it at?
Yes, it's very interesting. It's cool, actually.
Yeah.
And it's interesting to watch on a video swallow, someone saying what feels stuck right here when we can see something in a different area or see nothing at all. Sometimes there is sensory imprints is what I like to call it. That's my own term.
Sorry, I want to read the rest of her question.
Okay, yeah.
Or comment here.
Oh.
So, reflux over the years.
Yeah.
So, how do you keep it from being inflamed? You choose foods that are anti-inflammatory and that support your overall wellness. And you choose foods that in the moment don't cause extra inflammation. So you typically, if you have inflammation, you want cool foods. So you want to avoid foods that are hot and spicy. And so I sort of refer to Ayurvedic medicine for this one a little bit too, because in Ayurvedic medicine, they classify foods as hot foods and cold foods. So like oregano is a spice, it's an herb, but it's considered a hot herb, which you wouldn't necessarily think about. But whereas like dill is a cool herb. So so everyone tells you turmeric. So turmeric is considered an anti-inflammatory spice. Yes, it's not the only one though. There are many, many, many other herbs and spices that are anti-inflammatory. Follow a FODMAP diet. Yes. So that's a whole show in and of itself.
I don't even know what that means.
Fructo oligo di and monoglyceride. So they're types of carbohydrates basically. Okay. Fructo oligosaccharides. They're all types of carbohydrates, and they are based on how your body digests certain carbohydrates.
Gotcha.
So not all carbs are created equal, which we already know. But even among like onions and mushrooms, there are different kinds of carbohydrates in here, and your body digests them differently. This is why some people can't tolerate beans.
Gotcha. Because
they create gas and bloating and discomfort. And so Alyssa, I would say it's not just for SIBO. It's for 100 other things too. There's so much more to it than that. But yes, SIBO is one of those things that's actually a whole nother show in and of itself too.
Gosh, we're getting so many ideas out of this session.
So Kara, maybe you and I we need to do another anti-inflammatory. We hadn't decided on our topic for next week because
anti-inflammatory would be good after esophageal.
We're just wrapping up our dysphagia series now. So we did basic dysphagia, oral, and pharyngeal last week, and then esophageal. So maybe we'll talk about inflammation next week and do anti-inflammatory stuff next week again.
I like it.
Okay. Thanks, Kara. Appreciate your help there.
So follow us next week too, because we will do anti-inflammatory.
I'm going to throw another. So I got this little chopper. It's USB rechargeable. I have onion in it right now. I'm going to throw some garlic in it, and then we're going to throw it in with those meatballs. But if you need a little food processor for like one serving, this might be a great option for you. So it just comes off. This piece comes off, the blade comes out, and it chops up our onions. You can get them pretty darn small. So,
and
I got it for $10, I think at TJ Maxx. It's, Ray Dunn is the brand. And I'm always skeptical about stuff like this, but I kind of love it. I'm not going to lie.
Yeah, well, anything, and especially if you're on a level 4 or 5
diet,
IDDSI, you don't need the blend jet to get it to the point where it's pureed, but this is a perfect USB rechargeable that you could blend food on the go at a restaurant to a point where you can tolerate it. That's at your diet level.
So I have to answer this from Alyssa, even though it's to Kara. So curcumin is a molecule in turmeric. So all turmeric has curcumin. If you're taking curcumin, it's basically processing it to remove a piece of the food. Just eat the whole food. Don't separate it necessarily. So we like to keep things together because they're more beneficial together. Yeah. What do the numbers mean in reference to a diet? The IDDSI. Do you want to take this one?
Oh boy, I wish I had
one.
It is. I don't have the IDDSI with me to be specific.
I think at the top of our group, the Dysphagia group for nutrition and support that we run, at the top of the group, pinned at the top of the page, is the IDDSI framework, which explains the numbers. So it's levels 0 through 7.
Yep.
0 through 4 being liquids, and 4 through 7 being solid foods. And some of them, 3 and 4, overlap for liquids and solids.
But you can Google IDDSI levels, and it's a pyramid looking type. It's actually intersecting pyramid.
Yeah,
I think
there are two. One's upside down, one's right side up.
Right. So look that up. It's very specific. It gives you good information. Alyssa says, I only asked because other anti-inflammatory herbs, spices have curcumin in it. So I was trying to think of things that may need to avoid that component altogether.
No, so curcumin is in turmeric. So if you're eating turmeric, you're going to get the curcumin. And so this is why I say buy whole food. Like if you can buy whole turmeric, it's really hard to find around here especially.
Whole Foods has it.
Whole Foods probably does have it.
Yeah.
But if you're buying supplements, typically they have curcumin in it. I would say don't get a supplement. Just eat the food that you add turmeric to.
Okay.
That's my recommendation.
Gotcha.
I have ideas for recipes if you need them. Send us a message.
Send us a message, please. Thank you, everyone. I'm allergic to mustard. Wow.
She's allergic to a lot. Yeah. I know, Kara.
I'm so sad for you to be allergic to mustard. I really love mustard.
Oh, that's the one thing I didn't pull out of the fridge for this, by the way, was Dijon mustard. It's the one thing
Dijon?
I didn't. Yeah. Would you grab that? I'm sorry. Kara, I'm trying to mentally keep track of all the things you've said. Mayo's okay. That's good. Steph's a mayo girl too. She loves it.
Okay, I'm gonna come back. I love mayo. I love mustard, but if I could choose mayo over mustard, I would choose mayo. Here, I have a squeezable Dijon now.
Thanks. I'll just squeeze some in. That way I don't have to get another dish dirty here in a little bit.
Okay.
Okay.
All right. So let's go back to esophageal. Unless there's other questions. I love all of this conversation.
Questions are good. I know.
So we're talking about symptoms. So the last thing we talked about is a feeling of food getting stuck. Where it's getting stuck is the differentiation, and that's what we would need to know.
Yep.
Coughing or choking. Now, we all talk about the swallowing happens at this level, and esophageal is this level. But truly, you can have backup that's going to make you cough. Or if you've got no space for food being swallowed to go down, it's going to feel like it's going down the wrong tube. So you will cough. You will, I don't want to say choke, because choke actually means that there is an airway obstruction.
Right. It did go down the wrong tube, and it is stuck there.
Right.
Choking.
That would be choking. But just coughing is very different. Coughing is good. Please never stop your cough. Always cough. If you have to get up and walk away, go to the bathroom, go somewhere else to get your coughing done so that you're not embarrassed in front of people. I totally support that. But please let yourself cough. The cough is actually forcing the body to move it out of a place that it shouldn't be. Also, if it's one of your loved ones that is coughing, please don't pat them on the back. Don't do this. That is a big no-no. And let me tell you why. It's okay for you to rub their back, but don't hit it like this. The reason for that is because if you're hitting it and it's in the wrong tube, you're actually forcing it to go further down in the wrong tube. But if you just rub to help relax them so that they can cough it up, we don't want to force it down. By doing this, gravity is going to take it down.
I learned this from you in like 2018, and I have never forgotten it.
Never pat somebody's back.
I stop people from patting other people on the back now.
Do not. Please do not.
Do you get that stuck feeling in your throat? Yes. Janet, maybe you should come talk to us sometime. We want to hear about this.
Yes. Yeah. Janet, I would love to talk to you. I need to know more. Very curious. So coughing or choking. Choking would be you can't breathe and people do the Heimlich on you frequently.
This is also where some of the phagophobia comes from, because if you've choked in the past, you may have the fear that it's going to happen again.
Right.
So we see that a lot too, is that fear can also lead to anxiety and muscle tension and can cause other problems.
Which leads me to my last one, which is an unintended weight loss.
Love it when it works out this way, that I say the right thing.
That's why we're so good together. So unintended weight loss. You don't mean to lose weight, but you are losing weight. And maybe it's because you're afraid to eat. You're afraid to swallow things. You're afraid to try different textures, or you're afraid to try different strategies. That's something that we want to talk. We want to talk to you about. We are getting more and more experience in this area. Most speech pathologists and dietitians don't want to touch that with a 10-foot pole. We are digging deep in this, and we are getting experience in this, and we are working with people. Those look amazing, and they smell good too.
Yeah. They're not quite cooked all the way through, but we're going to get the rest of our stuff cooking, and then we'll put them back in, and we'll let them simmer so they cook all the way through. So I have the onions going in the bacon fat, and I added the garlic, which I buzzed in my little chopper. If you don't know how to use a knife, this little chopper is, and even though I know how to use a knife, I love that thing. It's my new favorite little tool.
Don't like using a knife.
I'm not going to add all these mushrooms because it's a lot of mushrooms.
That's a lot of mushrooms.
Who knew?
Is that how much the recipe calls for?
The recipe calls for 3 cups sliced, and this is closer to 5. But that was one little container that I bought. So these are baby Bella mushrooms. If you don't like mushrooms, don't add them. Yes, you're right, Kara. They will shrink. That's right. They're mostly water. They will get smaller. But I'm still not going to add all of them. I don't like them that much.
I would do all mushrooms, but yes, put the amount that you want.
You know what though? Here's the other thing. They're going to puree beautifully.
Yeah, they are.
So I'll add them all. All right, you talk me into it.
Do it.
Okay.
Okay, so the unintended weight loss, possibly because of fear of eating and swallowing, possibly because you're working, the work that you have to do to swallow and eat is burning as many calories as you are eating.
I added more oil to that also.
Therefore,
yep.
Okay. What kind of oil did you add?
Olive oil.
Okay, my favorite.
My favorite too.
Okay. So that's the last of the symptoms that I have. Do you have any other?
I think the only thing we haven't really talked about is the difference between reflux and regurgitation.
Oh, you're right.
And that was something last time that we wanted to make sure we really, really discussed. Thanks, Kara. I did.
Dump it. I agree, Kara. I am a mushroom girl. I love the mushrooms.
Okay, sidebar before we talk about reflux versus regurgitation. Mushrooms are a good source of vitamin D.
in the Midwest.
So everybody needs vitamin D. It's very rare that I see someone with an elevated level of vitamin D. Most of the time I see, oh my gosh, what's the word? It's way too low. Depleted, insufficient. Even mine,
Low.
like the first time I had mine checked, mine was at
Minimal.
13, and it's supposed to be higher than 30. So sunshine vitamin, also present in mushrooms. If you're taking a supplement called ergocalciferol, which is vitamin D2, typically you take it in super, super high doses, like 10, 20, or 50,000 international units. It's D2. So it's the vegetarian.
When I lived in Grand Rapids, where they don't get much sun, I had to take like 50,000 IU.
Either every week or every month.
A week.
Yes.
No, it was a month.
Yes.
And it was a month.
So people that are super depleted, so like my dialysis patients, when I worked in dialysis, we had people on it weekly.
Oh, that's...
Because the kidneys are responsible for vitamin D production. But everyone I know is deficient in vitamin D. Almost everyone, including myself.
Except for those that live in maybe the Sunshine States.
If you're in Florida, you probably are okay. But
my Louisiana peeps...
Go outside,
Mississippi, Alabama.
15 to 20 minutes a day soaking up the rays, and you'll be...
Right. Put sunscreen on, though, please. All right. So, that is the gist. Oh, we didn't talk about...
Sorry. Reflux versus regurgitation.
Reflux versus regurgitation. So, reflux. Reflux is when you eat food, it goes all the way to the stomach, mixes with the stomach acids, which is the natural thing to do. And then for some reason, your sphincter at the lower esophageal juncture does not work well. And then the food and liquid, the food and acid comes back up. And it can come up as high as your mouth, your nasal cavity.
Yeah. And if that happens, typically you'll taste it. And it does not taste good. Stomach acid does not taste good. So that's reflux. What is regurgitation?
Regurgitation is when you eat and swallow food. It goes into the esophagus but does not make it to the stomach to collect the acid
and just
or mix with acid. And then it comes back up. And that's part of your esophageal dysmotility.
So the esophagus, those muscles do peristalsis, which means they have waves of pushing stuff down your esophagus. So it takes, from the time you take a bite, it takes like 7 or 8 seconds, from what I understand, for food to go from your mouth after you swallow into your stomach. So if you don't have that peristalsis, those waves pushing stuff down, it could take closer to a minute. Or more. So what happens if something gets stuck? Because this is a question we've answered for a lot of people. If something gets stuck and you feel like something's stuck, what is the sign that there's actually a blockage?
Eventually nothing will go down.
And it'll come back up, right?
Right. So if it feels like something's stuck and you truly feel that, drink something carbonated.
If you can. Not everyone can. For those of you that can, try it.
If you can. If that carbonation comes back up into your mouth, you have a blockage.
Kara, you were right. Stephanie, you were right.
So very little there.
Yep. It also smells amazing. Okay. Can you? Yep. Okay. So next to this, we're going to add thyme, and we're going to add a little bit of butter. Where did the butter go? I didn't get that out because I didn't want to scoop it prematurely. So Steph has this great little butter bell here. And I'm just going to add like a tablespoon. I think the recipe said 2 tablespoons, but I'm adding a tablespoon. Okay. And then, so thyme is one of those herbs that we would consider anti-inflammatory. The leaves are typically soft, and so they should puree well. Janet, it's likely you are definitely going to want to talk to your doctor, if not your gastrointestinal specialist, because they will be able to run tests to tell you if that's what's going on. If there's damage from reflux, yes, it can cause some of that regurgitation if there's lack of those waves pushing things down. You're going to need to talk to your doctor because they can run tests to tell you if that's what's going on. Steph may have more to add to that when she comes back in a second. Okay.
Okay, I'm sorry.
No, you're fine. So she was just so Janet, I would love to talk to you.
Reflux. Oh yeah.
Privately. Please.
Could be having regurgitation due to motility. So the damage usually is from the acid. So regurgitation, unless food sits there long enough to where it actually rots in there, I don't think that you're getting damage from regurgitation. It could be that you are getting some backwash of acid, and it's the acid that comes back up that causes damage to the esophageal lining.
And so typically the regurgitation would happen after the inflammation has built up.
Yeah, or if there may not even be inflammation at all. It could be a motility thing.
Right.
It could be that the muscles, the smooth and striated muscles of the esophagus aren't doing what they need to do. And it's just kind of hanging out. And so just the pressure from your GI system makes it go up and makes it go down and makes it go up, and it could come all the way up into your mouth.
Yeah.
Well, that smells so good. You put the thyme in, didn't you?
I did. I love thyme.
I know.
I'm going to add a little bit of water too, because that's what it said to do. Even though I don't know that I need to.
Janet, what kind of swallowing tests have you had? I'm about to talk about the tests. So there are a number of tests for us in esophageal dysphagia that can be run on you to find out what's going on. So the first one, or one of the most common ones, would be an endoscopy, where they go down with a camera and basically look at the lining of your esophagus. And doctors, they're so smart. I mean, they can look at things and know what they are, but they can also take. Did you use that yet?
Not yet.
Oh, they can take a sample of the tissue to see what's going on and run tests on that.
Yes, and I have heard people say this can be a little bit painful afterwards. There are some food things you can do: drinking cooler liquids, not drinking hot liquids, eating things that are not gonna trigger you. So foods that cause you some indigestion in general. We try to stay away from those foods after these types of tests, just so that little area can heal.
Yes.
Yeah. Okay.
Very good. Another test would be a barium swallow. Not to be mistaken with a modified barium swallow.
You're going to have to tell us what the difference is.
Absolutely. So a barium swallow is really a upper GI.
Yeah.
Essentially.
Okay.
Upper GI. To where, so they have you, it's similar to a modified barium swallow, but a barium swallow, they have you drink barium, and they'll look at it going down, and then they'll lay you down, and they'll look at what it does after, what that barium does afterward. So it's mostly an esophageal test.
Okay.
So a modified barium swallow is where we modify that barium swallow, but it is more about the pharyngeal level of swallow. That's what we as speech pathologists are part of or do. We typically are the ones that are running that that X-ray exam, where we modify it, and we may use different consistencies of barium, and we'll also put that barium on different textures of food.
Yeah.
And we're looking at the pharyngeal level, but we'll also ask the radiologist to go down and look at the esophagus as well. It's not as intense a study of the esophagus, but they can go down and scan the esophagus to see what's going on. You can see regurgitation if that's happening, and you can see if it empties and if the things that you're swallowing is emptying into the stomach. Mm-hmm. So that's a barium swallow. So another word for, or another term for a modified barium swallow would be a video fluoroscopic swallow study. So VFSS, video fluoroscopic swallow study. And that really is just describing that they're videoing it. And so most modified barium swallows nowadays are actually videoed anyway. So most of them are video fluoroscopic swallow studies. Mm-hmm. So there's also manometry. Mm-hmm. A lot of you may have had manometry. Yep, those are awful. I have never been through it, Alyssa. I couldn't tell you, but that's interesting. It is where they will measure the pressure in your esophagus. So not comfortable as expressed by many people.
Yes.
I can't see that one. Hold on. Tube through my nose to measure the effectiveness of my swallowing. Yes. So there is another, I didn't even write that one down. So there is another swallow study called FEES, FEES, which is fiber optic endoscopic evaluation of swallowing, FEES.
And you were also certified to do this one, if I remember correctly.
I am certified to do FEES. That is where you take a scope and you put it through the nasal cavity, and basically you sit that camera right above the juncture where the esophagus and the larynx, or the airway, mm-hmm. is, so that you can see what's going on. Right. So it's basically a diagnostic test.
Right.
It doesn't give you as much clinical information as a modified barium swallow, mm-hmm. which is why I prefer doing a modified barium swallow. Yep. You can get more clinical information from it.
Yeah.
So manometry, and then pH monitoring. So there, and I'm understanding that they do pH monitoring by a pill that you swallow.
Yeah. Someone, was it last week or the week before, left us a comment that they do it, because from what I understood, they used to put something in there and just leave it there for 24 hours, and now they just have you swallow a pill.
Yeah. And it just kind of hangs out in your esophagus for 24 hours.
So much easier than...
Right. So, but that would measure the pH level, and that would tell us a lot about if there's excess of acid in your esophagus, which you don't want acid in the esophagus because the mucous membranes that are in the esophagus are depleted by acid.
So we didn't talk about that.
We didn't.
So do you mind?
So no, okay. My outline did not do as well as.
No, that's okay. We just we used a different outline than we did last time. So, but all these things come up. So your stomach is made of cells that are long, and they are there to protect your membranes from the acid. So your stomach is built to handle acid, and it's a very, very caustic environment, right? Your stomach produces hydrochloric acid to digest protein, and your esophagus is basically made of skin cells. Mm-hmm. So your esophagus looks just like this. This cannot handle acid. If you're like me and you get a little bit of stuff on your skin, you're gonna be like, it hurts, make it stop.
Burns.
I'm sensitive. Your esophagus is sensitive. So if you have acid going up there all the time, you're probably going to feel it. There is such a thing as silent reflux, so there are people that don't feel it. Mm-hmm. But over time, your cells will start to change, and basically your stomach cells will migrate and start to grow into your esophagus. And this condition is called Barrett's esophagus, because mm-hmm. your body is trying to protect itself from the acid.
I had that written somewhere. Barrett's.
Yeah.
And I failed to say it. But yes, Barrett's esophagus.
Because you knew it was going to come up.
Well, you know.
Yeah,
it did.
It is I think that's all we need to say about it for now.
Yes, and so it hardens. It basically hardens your esophagus.
Yeah, and it's a protective mechanism. Your body is really good at figuring out how to protect itself, and that's one of the ways.
And sometimes those protective devices is what harms or is so hard on your swallowing mechanism, because your body is trying to protect its property, while you're trying to use that property to move things around. How's that coming over there?
We're there. It's bubbling away nicely. So it smells delightful. I did not put the bacon in because I don't think that's gonna puree super well.
Yeah, it'll be crispy.
So if you're making this for your family, you can add the bacon in at the end for them. For you, we're gonna do it without it. So the bacon I have just back here, just hanging out, chopped. We did do pudding.
We did.
So we did make a
also
dessert.
Had something in there.
Oh, thanks for reminding me.
Did you remember that?
No. You grab me a cutting board?
Yeah.
So this is another thing that I like to do because it's super easy. So I have a sweet potato, and it's been in there for an hour. I just took a whole sweet potato, put some oil on it, put it in some foil. Foil, once you take it out of the oven, loses its heat very quickly, so I'm not going to get burned by this. So the great thing about it, it's very soft too. So if we cut this sweet potato in half, the skin will slide right off, and it's going to mash very, very, very easily. So you can make a pureed sweet potato almost just with a fork.
Yep. Doing
it this way. You can add a little bit of butter. You can add a little bit of...
The butter will make it smoother too.
Salt. You can add a little bit of So sweet potato. I'm just going to cut it right in half. Don't do this at home. Wait for it to cool just a little bit. I guess I'm just going to peel it right off instead of sliding it off. So that skin comes right off just like that. It's easy as...
And sweet potato skin is not as easy to eat as regular potato skin.
It's not. It's a lot tougher. I made some roasted sweet potatoes with the skin on the other day, and I had to chew and chew and chew and chew, and I don't like that because my jaw doesn't like that. So if you have trouble chewing and swallowing, don't eat the sweet potato skin. I'm just going to take this last little, there's a little just like eye here where it's stuck. So
it's probably the belly button.
All right, super soft. So then I have another half here. Did I get a little hard piece? Not.
No, it's just the eye.
Just take a little bit of butter. I made your butter bell not pretty, I'm sorry. And we can just
mash it up.
Mashed sweet potato. Did you know it was that easy?
And if you can't handle that texture or consistency, you can put it in your blend jet and with a little bit of water or a little bit of liquid butter or a little bit of milk of your choice.
Yep. And it'll get it super soft. Come back here.
Oh. Tried to get one in a month.
Oh, Kara, I'm so sorry. We're just reading your message now because we were backed up a little bit. Yikes. I'm so sorry to hear that. That breaks my heart for you.
Me too. Terrible.
All right. Sweet potato. That easy. Mashed sweet potato. Thank you for reminding me. I was going to do sweet potato on the side of our chicken.
Yeah.
We got to have a well-rounded meal. Sweet potato is great because it's got fiber and good carbs, and it's delicious also, if you can tolerate it. Some people can't. Okay.
All right.
So I think we're just about ready to puree a meatball.
Let's do it.
Okay.
I've got the blend jet.
Okay. Sure. Yeah, it's the great thing about meatballs. You can just cut them in half in the pan to make sure they're cooked all the way.
And they're smaller, so they cook quick.
Yep. Okay, and then I am gonna grab a little, a ladle to get some, to get some of this liquid in here, and a couple of the mushrooms.
All right.
Actually, this is hot. Gonna get a prettier bowl.
Yeah. Got one of our flea market finds.
Beautiful. We love our thrift store, don't we? Okay. Actually, you know what? I'm gonna try it doing it the way someone else mentioned to us.
That was Shannon.
Shannon did tell us that.
Yes.
So Shannon, if you're watching, I don't think I saw her on. If you're on, please say hi. Do canned mushrooms puree well? Yes, I would. I have not tried it, but yes, I would think that canned mushrooms puree beautifully.
Yes.
All right. Sounds great.
So let's talk a little bit about what Shannon told us about the. So when you puree warm or hot things, there's a tendency for pressure to build up inside. So if you have a big blender that has a vent on top, then you vent it. But on these little blenders, it's difficult to vent it. Well, Shannon, one of our followers, told us one day to cover it with a towel. What a genius idea.
I know. So this looks like it blended.
Oh my gosh.
Almost
perfectly
on the first go round, which doesn't normally happen.
With one?
So there's a tiny bit of texture in there, but it tastes delightful. So I'm going to blend it one more time.
I think if you put a little extra, oh, that tastes good. Put a little extra fat in it, like butter or... Wow, that's got really good flavor.
This recipe book has been really good so far.
So typically we find when there is a texture that's difficult to get rid of in pureeing, especially meat, adding, I don't know what I was thinking, adding fat.
It's habit. It's habit. Yeah, adding fat is always helpful for pureeing meat. And so I really wanted to do the ground chicken because it's so much softer, which you saw when I was making those meatballs. It was so sticky.
But it is also drier.
It is drier. Yep. Because there's less fat in it. It was 90-10. Yep. All right. Shall we give it a go?
Yes.
It looks so smooth. And you can't even tell that there's thyme in there because the thyme blended beautifully also. So if we just do...
That extra butter in there.
Made a huge difference.
It really did. Try it.
So here's... If we were doing... Well, yeah. If you need it pureed, you're going to have to puree the sweet potato because there's some fibers in there.
A lot of fibers. But it's still smooth.
For IDDSI, the sweet potato, because it's so much thicker, would be a level 4. And then this would be closer to a level... I think it technically would still be considered a level 4, but it's smoother. Because when you get into the liquids, there are some very specific...
It's delicious.
We do a flow test with a funnel. Thank you. To figure out what the appropriate thickness is. And I have done a video before. I think it's time for us to do another one because we did it a long time ago. These meatballs are completely smooth. Oh my goodness.
That extra butter.
Fibers start getting challenging for you. Yes. Alyssa, they're gonna be challenging for you, and that's okay.
Don't start with fibers.
Don't start with stuff that's fibrous. We want to start with stuff that's smooth, right? And we'll work up to fibrous. Okay, so you're gonna do a minced and moist now?
I am.
My mouth is watering. This is so tasty. So with minced and moist, we had a question on Instagram from a lady earlier today about level 5. So level 5 is considered minced and moist. So Stephanie says if it'll go through the tines of the fork, it can be considered minced. For those of us that are not going to mince it with a knife,
I'm going to show you that this is the part that browned,
the crust,
and that's not going through the tines of the fork. So that part of it would not be minced and moist. So I'm going to take that part. So if you are in a restaurant or you are somewhere else, you don't have a blender with you, use a fork. El manual. Do it manually.
Do it manually. I like that. I was like, what are you saying?
And so I don't know how much oh yeah, you can see that on there.
This is gonna need a little bit of moisture too, right?
Gonna go there next.
Where I'm gonna put a little bit in here.
Yep.
And let you pour it in.
I'm going to take off the other part, that's the browned section, but the middle of the meatball is perfectly. Go ahead and pour it on.
That was like 2 of our little ladlefuls. The mascot needs some. He thinks he does need some, let me tell you. I love that you called him the mascot too, Alyssa. Appreciate that.
He's the smelly mascot and
we
does
had
not
some,
need.
We had some pictures done months ago, and the dog had his beautiful sweater on, and he refused to get out of the pictures. So we have business pictures that have the dog in there with us. So maybe we'll have to post that on in the group page.
We should.
So
the Dysphagia Trio.
The Dysphagia Trio, yes. You're part of the group.
We'll post it because it's actually kind of funny.
That looks beautiful.
The mushrooms are not going through the tines of the fork, so that
pull those out.
Would not be minced and moist.
Right.
This right here, less the mushrooms that are in there, is minced and moist. Try it.
So let me tell you, if I had put the mushrooms in my handy dandy food processor, they would be considered minced and moist because they would have gotten really soft and really small. So you can do your mushrooms in the food processor if you don't want to do them whole like that. And it's going to be the same outcome, except they're going to fit into minced and moist so much better. You just have to chop them all the way.
If you don't have a chopper, a knife will do it too.
A knife will do it too.
But chop it before you cook it, and then they'll be they'll be smaller because they shrink. Shrinkage, right, Kara?
There's just enough that the teeth have to do some work. I could have even put a little more liquid on there. So that's the thing. You can always add more liquid to minced and moist. To puree, you have to make sure it's the right thickness for you. So you can't always add more liquid without having to add more thickener.
Yeah.
But that's the great thing about this is
I'm not going to lie to you.
I use breadcrumbs.
The puree is tastier.
Tastes better than the minced and moist.
I do.
Don't you love it when that happens?
The puree tastes, it's actually got more flavor.
So this would be a recipe where, thank you, Kara. This would be a recipe where I think we call this a win for pureed food.
Absolutely. It's better puree. I'm not lying.
It's really tasty.
If you don't want to eat that, I will.
So your sister?
It's much better this way.
It's so good. It's so good. So, okay, so I'm going to talk a little bit about our pudding.
Yes, do.
So it was National Cherry Cheesecake Day last week, and I meant to do a video, and I ran out of time. So I just got a box of, as you can see, cheesecake pudding, which I got on clearance because I'm cheap like that.
Frugal.
Frugal, yes. My dad's not on today. I got it from him. Got it from you, Dad. Thanks. I appreciate it. So we just took our basic cheesecake pudding mix and I added a protein shake. Instead of milk. And because we needed 2 cups, so I could have just added 11 ounces and it would have probably just been really, really thick, which would have been fine. But we added a little bit of milk to it because I do follow the instructions sometimes, and it said to add 2 cups of milk to 1 packet of pudding mix. So we were gonna do a blueberry cheesecake. It's still pretty thin, isn't it? I wonder if that's because it's... And we're teaching weird. It's me. Pudding mix and I have terrible luck.
Where's
You want this guy?
No,
that's a weird. Oh, okay. I was gonna say that's a weird whisk stuff. I gotta grab the other blender. I didn't think we were gonna need it, so I forgot to grab it. I guess I can turn the oven off now because
it's done.
We're done with our.
Well, if we're gonna make a shake, it doesn't matter how thin it is.
That's true. That's true.
It doesn't need to be thick.
I mean, we could do this shake or we could do it as actual pudding. It really doesn't matter. You know what I mean? So, I mean, it did thicken. Maybe it's just because I added a little too much liquid.
So we used our cherries last week, so we're doing blueberry this week.
Yeah. So the reason I did the protein shake in the pudding mix is because sometimes you need a little extra protein. So this one's Orgain. Kara, you need to send us a message when we're done so I can chat with you, FYI. So this is Orgain. Orgain has plant-based and they have dairy-based. This one is a dairy. It's a grass-fed protein shake. Everyone has something different that they like. So I added like 2 ounces of blueberry pie filling to our blender. So you can just puree your blueberries and layer this if you want. It's fine. You can do it either way. I think we should do an actual blueberry cheesecake shake though.
I think that sounds amazing.
Amazing. And it's like you knew this was going to happen because you brought these beautiful little glasses. Okay. We love our thrift store finds so that we can
make things pretty.
Make things beautiful.
I don't know how much.
I don't know. Whenever you feel it's good, it's good.
Probably should have just
total. That's a chef answer. I don't know. It's done when it's done.
When it's good.
Yeah. Yeah, sure. I'm gonna turn the stove off because I think it's reduced enough.
They're done.
They're done.
What do you think? I think that's enough.
That's plenty.
It's half and half.
You're gonna love it.
I look, so for everyone that was watching last week when I said that I don't like cooked fruit,
she's not lying. In the 7 years I've known you,
I don't eat cooked fruit. But I'm changing. I kind of liked that. And this week I have been adding chia seeds.
I'm gonna blend this one more time.
Because
those blueberries have some thickness to them. Yep.
I've been adding chia seeds to my fruit.
Your applesauce?
To my applesauce, and I like it. And
so
I never liked chia seeds before because of the slimy, but I like it now.
I know, because they're so good. If you can tolerate a little bit of texture, chia seeds are a great option. If you can't tolerate texture, do not eat them. Right.
That's going to be a thick shake.
Yep.
Let's try it.
Okay. So in the nursing home, one of the things that we've always done is made pudding with half and half because it's got more calories. So if you need some extra calories,
it's very smooth.
Make a protein shake or make pudding or something with a protein shake because you don't just have to use milk. Although it doesn't ever get quite as thick. So maybe don't use as much.
Yeah,
I haven't mastered it yet.
So instead of adding to the proper amount of liquid for the...
I would drink that for breakfast all the time.
It's good. It's very sweet.
It's sweet and it's smooth.
It's totally smooth.
There might be a little tiny bit of blueberry texture in there.
And for those that
are hypersensitive,
they will find that texture.
Yep. And that's okay.
But you can also choose baby food blueberries. Mm-hmm. Because that has the texture, the majority of the texture removed.
I did find a blueberry seed in that one. Mm-hmm. So they are there. But yeah.
But for the most part, if you don't have sensitivity to the texture.
And it's very minimal in this. These blueberries are cooked well. They're already super soft. So I think this is good. We did the Coq au vin Blanc meatballs, which I used milk in the sauce. If you use cream, it'll be a lot thicker. Mm-hmm. Janet, I did fresh blueberries in my shake that I made for breakfast yesterday. There's just a little more texture. I had to blend it like 3 or 4 times with fresh blueberries because the skins don't break down as easily because they're not cooked. Yes. So if they're cooked, they're going to be softer. Fresh blueberries, if you can tolerate texture, are probably okay for you. When you're going through your fresh blueberries, you want to make sure that there are no stems left on them. Mm-hmm. So you want to be diligent about just checking as you're pushing the blueberries into your blender that you're making sure there are no stems on them. That's the only thing I would say because those stems are not going to blend. So, yeah, great question. So, Coq au vin Blanc meatballs, chicken meatballs, super smooth. I'm so impressed.
The pureed, we added a little extra butter to the pureed meatball.
Mm-hmm. Always a good idea when you're blending meat.
Just because the first blend, it was a little bit dry feeling, had texture. We added a little bit of butter, and it is delightful.
It's the smoothest chicken I think we've ever pureed.
It is delightful. The taste is
so
on point.
And this was a full meatball, including the crust like that you had to pull out in the minced and moist. Yeah. So this piece blended up beautifully also. And the mushrooms in there add that silkiness to it as well. Yep. So I think the mushrooms, see now, Kara, I'm glad you're just like dump it because
it helped.
It helped, and I'm not going to notice that there's five cups instead of 3 cups in there because you're right, they do shrink. So I love learning things and stepping outside of my comfort zone too.
Good stuff.
Cool. This has been a great. Thank you for all the interaction, everybody. So I will type up this recipe, or I'll even just post a picture of it, and in the group. So if you want to see a picture of the recipe, you need to come join the group. We love having you. We love
say
to
the
ask
name
questions.
of the group in case.
What if I get it wrong? Dysphagia support for nutrition and swallowing.
Dysphagia support for nutrition and swallowing. Yes.
Okay.
That is our group. So
because we do it together. Janet, you're very welcome. We look forward to hearing from you outside of tonight. Susie, you're welcome, my friend.
Hi, Susie.
She doesn't eat chicken because she's vegetarian, but you would like this too. This might be a good one for you to make at home for your significant other who does eat chicken. So it's just a thought. It's delightful.
So we have some fails and we have some wins. This definitely was a win. 100%. But that's why we're doing this for you guys, is so that we can trial and find the fails for you and let you know how to adjust those things that I cook it for hubby. You're so good to him.
Yeah. Say hi for me. I know I'll see you guys next month, but Say hi for me. We'll maybe have to video me, because I'm doing a cooking demo for her group next month. Maybe we'll have to do a video of the things that I'm doing for them, for everyone as well.
Great.
Because we're going to do a smoothie and whatnot. So,
nice.
Kara, if you have more questions, you were the one that wanted us to do the grilled cheese, which we wouldn't have done if you hadn't asked. So please ask, because we will try almost anything.
Yes.
Unless I have strong feelings against it for one reason or another. And if I do, I will tell you why.
And
so,
if she does, talk to me, because then I'll convince her that we need to try it and what the reason is. So that's why we work so well together, because we'll talk each other into things.
There's an accountability piece here.
And you know what? We need to try, so that if it's a fail, it's a fail.
Yep. And then we can tell you don't try it.
And if it's a nutritional thing, we can talk. We can talk.
Enjoy, everybody.
Have a good week.
Happy cooking, and please reach out to us. We want to help you. We did do grilled cheese. I'll find it for you and send it to you. Yes. It was on Soup and Sandwich
it's
Night.
back there. Yeah. Soup and Sandwich Night. Scroll back. It's there on YouTube. It might be easier to find.
It might be easier on YouTube, yeah.
Yeah.
Yep. We'll find it for you, though. Have a great night, everyone. Thank you for joining us, and we'll be back next week to talk about anti-inflammatory diets.
Yes.
All right. See you later, everyone.
Bye.
Cheers.